HITCon South Gujarat, 13 to 14 April 2019 at Surat. Healthcare Technology Conference for doctors, by doctors, powered by Management Medicos.
Monitoring system called ICU Care, which will revolutionize the Indian healthcare system. ICU Care is a breakthrough that enables treatment of patients by providing 24/7 critical care support by intensivists residing kilometers away. It is designed to solve the greatest healthcare challenges that India is currently facing: poor ICU and lack of intensivists and support staff in far-flung areas. Imagine a patient at a local hospital ICU in critical condition, requiring immediate treatment. The hospital is unable to proceed without an intensivist's advice. This is a very common and difficult situation across remote parts of India, where patients and hospitals both find themselves stuck and helpless. Now, imagine a scenario where the patient could be treated immediately, remotely, and without waiting for an intensivist to arrive on site and treat the patient. Remote intensivist advice is possible with revolutionary ICU Care system. We equip the remote hospital ICU with a mobile kiosk which will have audio-video conferencing capabilities. This remote hospital ICU is now connected to ICU Care Monitoring Center with a team of intensivists which is available online 24/7. Remote patients' vital signs, test reports, medical records are fetched from the ICU Care EMR system and displayed live on monitors at the ICU Care Monitoring Center. The patient information gets integrated into ICU Care web and mobile application. Intensivists have access to all the data and will provide the appropriate advice to the hospital ICU. It's a win-win situation that delivers a more accurate and effective intensive care for patients and give reassurance to the patients' families. ICU Care has multiple advantages like substantial reduction in mortality rate, reduced length of hospitalization for patients, decrease in ventilator time, increased cost effectiveness and efficiency in ICU, delivering high-quality critical care to patients of hospitals with limited staff and financial resources with an innovative and effective solution is the main mission of virtual healthcare. Ahmedabad-based virtual healthcare provides second set of eyes with the help of ICU technology to give additional clinical surveillance and support to ICU patients in disparate geographical locations for multiple hospitals. The scale and scope of our products can be enhanced manifold with the government healthcare facilities, joining hands with us to take quality intensive healthcare to every nook and cranny of India. Quality and effective intensive care unit operations are now possible in hospitals of any size with limited resources and investments. Allow us, the virtual healthcare team, to provide expertise in digitizing your ICU and get 24/7 intensivist advisory support for your ICU.
And everybody is probably waiting for the iWatch. That's what I believe. Fine. Today morning I had basically taken the EHR. Actually this topic and EHR almost should go together, but fine, it is already divided into one in the morning session and now this is at end. So here I am going to take you to the journey how to go for digitizing your office practice. So this is a declaration that how this is inspired. You must have heard about the digital doctor, hope, hype and harm at the dawn of medicine's computer age. So this is San Francisco's doctor, and that is how this whole presentation is inspired. So how to define our digitization of the office practice? A number of people, they are using word digitalization but that is not the right word. It's a digitization of the office practice. So paperless practice or less paper? This is like cashless or less cash? Let us come. I am coming that to afterwards. Then paperless office we all know. Then what are the actual numbers? What we are using papers and how much man hours we are using as far as our normal practice is concerned? And is this true that our perception that software is industrializing the medicine by turning doctors into data entry clerks? Is it true? Definitely, it's not true. If we properly use digitization of the office practice, so it is basically what is the problem? Problem is adaptive versus technical. The problem is with we people. Problem is never with the technology. So we have to be adaptive as far as this is concerned. So there are 4 stages. We are using software, right? And we are used to write on paper. Now we always fighting between this how to enter. Number of software now, they claim that you don't have to write anything. They have provided all the keywords. You have to just click with the mouse, so you don't have to write anything. So if you know how to operate mouse, you can just enter anything in the software. But that is also number of times many people are not comfortable. So how to go ahead? So EHR already taken in the morning, and just basically it's interoperability. And what about the actually role of any organization? Because all what we are doing till date is on individual level. Probably HITCon is one platform where the team is trying to basically encourage everybody to use the technology. But if you take the example of Americas or even Europe also, association plays very, very big role, and organization has to play a big role. So in America, American Medical Association has come out with basically this AMS Steps Forward series of practice transformation modules and Transforming Clinical Practices Initiative, TCPI. So they help doctors to digitizing their practice, they teach them, they train them. So organization role is very great as far as this is concerned. So we all know why to go for this digitizing office practice and everything. I'm not going into detail as far as that is concerned. So what are the myths? There are various myths right now running that people don't want to use digital services of healthcare. Another, only young people want to use the digital this software and everything. Third one is mobile health is the game changer. I'm sorry, that is also not the right thing. Patients want innovative features and they want everything fancy. That is also not right. And a comprehensive platform of service offering is prerequisite for creating this type of value and this thing. No, that is also not thing. So now number of studies have done, and you'll be surprised to know that in 3 different countries, Germany, Singapore and United Kingdom, what was the priority as far as patients are concerned? To get an appointment easily. That was the priority by the patients. So that is digitizing of office practice. We can wonderfully use that and we can just address this concern. So then other commonly cited needs include help selecting the right specialist and support for repetitive administrative tasks such as prescription refills. And what most of these services have in common is that they do not require massive IT investment to get started. That is where so how do we transform? Now say I'm practicing for 30 years. So initially we were not using computers. So all patients were getting that we are keeping the files and we give files to the patients. And because we are in the OPD practice, records we do keep, but what about the OPD papers? Now someone comes, I'm a pediatrician, someone comes after 15 years and my son or daughter is going to US and I need a vaccination certificate. So what happens? I have to just go through all these paper records and I have to prepare the vaccination certificate. It consumes my time, it consumes parents' time, everyone's time. So that is where the role of digitizing office practice comes. Your old records, you can very well transform it into the digital record just by simple scanning. And what should be the scanning standard? Is 300 dpi resolution, scan in black and white, and save in PDF format. I am coming later how to basically retrieve this thing. Once you already scanned, so how to retrieve this? How to convert it into the digital format, actual computer type. So, you know benefit of document scanning, everything. So again, this is all we know, but this is very important. So how do we store, digitize this thing? Okay, and many storage platforms. Now we are talking about the cloud platform. Number of cloud services are there, and most probably we are using Google or Amazon, AWS. These are the common cloud platforms. Number of people are using Dropbox and other this type of cloud platforms and online file storage, this thing. These all are paid software, and one can go for that. There is no problem in that. Another very good option is that you can have your own cloud at your home, at your place. So Seagate, Western Digital, they are having their cloud storage devices, which are technically known as network attached storage (NAS) devices. You can very well keep this cloud at your home at fraction of the cost which you are paying to these online platforms. And it is also not, we are not spending a bomb into that. Just 15,000 rupees, you get 4 TB of my cloud from Western Digital. So, and you have to basically create different access levels to access the data. So you have to divide it into two parts. Those data which you are regularly accessing, and those you are going to very less frequently you are going to access. So now these are the jugaad ways of to digitize. I don't want to spend anything. So these are very good ways. First and foremost, use of Word templates. Everyone is using Microsoft Office, and it's a Word template is a part of Microsoft Office. Like say I am Amit patient, and I have come to Dr. Pragnesh Bhai. Today he has saved my record in the Microsoft Word, and he has saved that file. Next time whenever I go, just he has to search Amit Bhai, the old record will come, and he can come to know, okay, this is what he has done. So this is the simplest way. Then comes the smart digital pen. Today morning Dr. Uman Bhai already showed one video of a smart pen. But the most common smart pens which are best as far as this is concerned is the Livescribe 3, which is costing around 15,000 rupees in India. Actual cost in America is just $99. Neo Smart Pen N2 and Wacom Bamboo Smart Pen. What happens with this is that this smart pen comes with a small pad and paper. This paper is basically technological paper. It's a A5 size paper, not the A4 paper. Whatever you write it down, the pen itself has 1200 page memory, and whatever you write it down, it is already stored. Your handwritings are basically transformed into the digital format, and you can directly access it on your computer or mobile device, whatever it is. So this is very good. Then comes the smartphone scanner, like Google Photoscan is free, but very good important software, and which is one of the best software as far as handwriting recognition is concerned, is Pen to PDF. It is just 350 rupees, and it is available for both Android as well as iOS. And believe me, you just write it down in your whatever, we have seen how doctors write, right? But this software is so wonderful, it is able to identify almost with 95% accuracy. And if you write it legitimately, slowly, and just a regular language, almost 99% accuracy is there. And what happens that whenever you scan it with this software, sentence-wise, it gives you editing option. So suppose I have written tablet metacin 500 milligram, and then dash 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 2. What happens that probably it will that tablet metacin dash dash might consider dash dash as some word, and then 500 another thing. You can just delete it and you can edit it. So that is possible, and then you can save it. So this is a very, very important software one should use. Even if you are using any XYZ proprietary software, you can start using this, and you can write down, because many people are not comfortable typing on computer or clicking on with the mouse. So, and how do we access documents? This last part I will be mentioning first. Use of simple search engine like everything. What do I mean by simple search engine? We know about Google search engine. This everything is basically your installable software, and it is available for both the Windows as well as the Mac platform, and it's a very tiny, just 53 KB software. What it does is that when you install it, it indexes the all file names and everything, and whenever you just click this everything and you write it down, and suppose I have saved my document Amit 13042019, the moment I start writing down AMIT, immediately it will show me all the file names with the Amit. So it becomes very easy for you to retrieve the records, because when patient comes, this is what we need. And when we are not using other software, we can, at least by this means, we can start digitizing our office practice. So I already mentioned this, that in 2 different folders, there are various ways. All people are comfortable with various ways. That see, I am comfortable with 2 folders, someone is 3 folders. That is a personal choice, that how I want to access the data. But yes, you have to prepare your folders like that, and this is easy. This is not a rocket science at all. This is not a complex IT at all. So this is in short digitization of the office practice. I already mentioned in the morning about whichever software you are using, make it sure that it follows the law, that is the EHR standards of 2016. So which are the options we have if we want to go for the software? Which one to go for? It's a big question. Whether to go for the online cloud-based like Precto, Librate, etc., or go for the proprietary one which is installable on your system. Originated in Western countries, are those softwares useful for us? So you have to go for the India specific, specialty specific. Data migration is big issue. I am using X software, I want to migrate to Y, but I am not able to migrate my data to Y. So we have to be very careful while selecting the software. Make these all points clear to the software vendor that yes, data is migratable and support is there in future also. In 2008, our Indian Academy of Pediatrics endorsed one software from Vadodara, and we made it IAP pediatric software. That fellow was wonderful. For 3 years nothing was there, everything was fine, and suddenly in 2011 he just went to Canada and he sold his whole software company to someone else. Now this is 2019, he has not come back, and those who have gone for that particular software, they are finding it now difficult to how to go ahead, because that company is there, company is providing support, but they are charging a bombshell because that's a proprietary software. And now this new vendor, those who has already acquired the new company, he is saying that I do not have the access to the all these technologies, so converting to new technology, it will charge. So that is how these people are milking money. So make it sure that whichever software you are going for, that it should be able to migrate the data and proper support is there. I am sure this is just, I would say, I am just highlighting all the points and just encouraging you people to start digitizing your office practice, even in a small way, then you can go in a big way. So thank you very much. You can share your experiences at emr@teenageclinic.com if you wish to, or if you have any question. Thank you very much.
Thank you.
HITCon South Gujarat, 13 to 14 April 2019 at Surat. Healthcare Technology Conference for doctors, by doctors. Powered by Management Medicos.